Hi everyone, it's Dr. Jhawar with Revive MD. So I want to talk a little bit about fatty liver today. I get asked about this quite often because I see patients who are struggling with excessive weight gain, diabetes, high cholesterol, and when I look at their blood test reports, we see, maybe some elevated blood sugars, maybe elevated hemoglobin A1C, their cholesterol is elevated, and then I see that their liver function tests are also abnormal. And that's a clue that maybe they have some fatty liver. So there's something called non-alcoholic fatty liver disease where patients just have fatty liver. And there's also something called NASH, which is non-alcoholic steatohepatitis, where patients have fatty liver, but there's also inflammation there too. So that's really important because these are conditions that are reversible, but of course, that means there's got to be some targets for reducing weight, reducing blood sugar, improving diabetes, and cholesterol. Those are the ways to really manage it. We don't really have like a magic pill yet for fatty liver disease, but these are the ways to kind of improve it and reverse it. You want to try to do this earlier on because you don't really want it to lead to things like more scarring in your liver or cirrhosis. And it's a very important disease to really recognize because it doesn't cause symptoms in patients. So oftentimes it's really an incidental finding, and usually it can be detected on an imaging test like a liver ultrasound. So, how do you really manage this, right? So yeah, you're gonna have to, work on ways to improve your diabetes numbers and reduce blood sugar because of course, elevated blood sugars can be very inflammatory, just like it can be causing more inflammation in the liver. Reducing your cholesterol if you have high cholesterol because that can also be very inflammatory. And then working on weight loss or reducing your weight because the more you gain weight, the more likely that the liver is going to become more fatty and then start getting more inflamed and then lead to more scarring or cirrhosis. There are some studies that are going on right now looking at medications like Mounjaro and Zepbound, or that are known as tirzepatide. These are your GLP-1 and GIP receptor agonists that help with insulin secretion. There are studies that are actually looking at those medications being as potential treatment options for severe stages of NASH or fatty liver disease, where there's already inflammation and maybe even some possible scarring. So that's pretty exciting because we don't really have any other medications out on the market yet that can help with reversing this. But that would be really great if that's also an indication where these medicines can not only be used for patients with diabetes and obesity, but also be used for patients who have fatty liver disease. So stay tuned for more. I'll be back with more videos. I hope this helps you learn a little bit more.